Hey everyone, it's Rachel, and today we're going to be talking about Type D personality. Now, most people know about Type A and Type B, Type A being a very high-strung, really go-getter kind of personality, and Type B is more laid-back, kind of doing things on their own pace. But a lot of people don't know about Type D personality. Type D personality was originated in the 1990s, around 1995, and D stands for distressed. So Type D personality is defined by social inhibition and negative affect. So, social inhibition is what most people call anxiety. So basically, not necessarily not being able to talk your feelings out to somebody, but feeling like you're going to get judged or people are going to think lesser of you because of your feelings. So you kind of keep them to yourself because you're afraid of what people are going to think of you. The negative affect being always down on yourself, what most people think of as depression. So there's a very strong link between Type D personality and people with anxiety and depression. In the studies that I found for this project, there were some studies done for cardiovascular patients and also evaluating people that work within the medical field. The first study is a study done by Oginska-Bullock et al., and it's a study that evaluated healthcare workers and how Type D personality can affect people in the workplace. So the study done by Oginska-Bullock was a study that evaluated 25 male psychologists and 26 female psychologists, along with another 28 female nurses. And what they did is they had them take the DS-14, which is the standardized test for Type D personality, along with a few others, the subjective work evaluation questionnaire, which is how people react to their work environment if they're okay with their work environment. The MBI, which is job satisfaction, different from the work environment, how it's more how your job is working and if you're satisfied with your job, if you feel like you are making a difference with your position. And the GHI-28, which is just a generalized health form that they use as a standard, making sure that people that have Type D personality don't already have other pre-existing conditions that could cause them to have Type D personality. Now, they found out that females had nearly a 2-to-1 ratio of having a Type D personality compared to the males. Obviously, that number is a little bit skewed because there were more than twice as many females as males. So there is that kind of difference there, but they did still find a 2-to-1 ratio. And they noticed that people that have Type D personality have more burnout, they're more exhausted, and they do have physical effects from having their high-stress healthcare job and Type D personality. The second study is one done by Lee et al., and this one and the next one are both studies that were done in Japan. This one is about the 6-week rehab program. They made up a 6-week program for post-operative cardiovascular patients. So people that had stents put in or other open heart surgeries. People were disqualified if they couldn't talk, if they couldn't speak Japanese, obviously because this study was done in Japan, or if they had suffered from a stroke or any other kind of pre-existing conditions like that. So they had the patients take their CPET, which is the standardized physical therapy tests at the beginning and at the end to see their progress. They also had people take the Type D personality test, which is the DS-14 again, and the HADS, which is the Hospital Anxiety and Depression Scale. Now, they found that in the end, there were only 5 Type D personalities and only 22 that weren't out of the 63 that they had initially had in the beginning. Now, this study tries to implicate that people with Type D personality are more likely to drop out or to not recover as well, but in the 5 people that they had that participated and that were Type D personalities during that 6-week rehabilitation program, they actually exceeded the people that don't have Type D personality. Whether it's true if Type D personality does inhibit people's recovery with cardiovascular surgery, I honestly don't think so. I think that their reasoning of saying that because they had so many people dropping out, mind you, there were only, I think, 15, I want to say, that dropped out because they had so many fewer people with type D personality. They believe that because those people dropped out, those are the people that wouldn't have recovered as well. I don't necessarily believe that. They could have had other pre-existing reasons why they didn't want to go through the entire rehabilitation program. Maybe they weren't happy with the rehabilitation program that they were going through. It's all kind of up to everybody who wants to determine it for themselves. It's not really something that is cold hard fact. The last study was done by Matsuishi et al., and it was a study done on post-cardiovascular surgery patients on their 1-week recovery within the hospital. They measured the amount of delirium and coma days. So basically what they would do is after the surgery, they would come in and check on the patients a few times a day, and if they were in delirium or had a coma, so they weren't fully functioning the way that they should be, as a normal healthy person would function, then they would mark that as a delirium or coma day. It doesn't necessarily have to be they're completely zonked out in a coma all day. It can just be if they checked on them every 8 hours, if they were out for this one 10-minute period that they happened to check on them, but then they were fine the rest of the day, they're still going to mark that as a delirium or coma day. So what they found was that it was a 10-month cross-sectional study, and they had a total of 142 patients that were included in this study. So before the patients went into surgery, the day before their surgery, they had taken the DS-14, again, the standardized test for type D personality, and this can kind of construe the data. In this study, they talked about how that was actually a good thing that they had them take the test the day before, because when they take the DS-14, if it's before a stressful, anxiety-filled situation, that's supposed to bring out those type D personality traits more, but you're also trying to evaluate better what the person was before their surgery, and not necessarily right before the surgery, because most people are going to be freaking out, and if you're going into open heart surgery, a lot of people are just thinking, well, I'm going to die on that operating table. So obviously they're going to have more depressive thoughts, which could skew them to be more type D than maybe they actually are. So with the 37 type D personality people that were in this study, there was a larger range in delirium, but the coma days were about the same. So delirium would just be kind of out of place, kind of not able to think clearly. So they found that on average 1.1 delirium days with a plus or minus factor of 1.5 were found in type D personalities, and people without type D were an average of 0.4 plus or minus 0.8 delirium days. So the thing is, with this study, they found that the amount of delirium and coma days, or DCDs, that were found aren't necessarily because of depressive symptoms. It's only present if there is also the presence of type D personality. Now, one of these studies actually incorporated the fact that maybe there is some kind of biological marker for people that have type D personality, which would be a good idea, and it's a solid statement. A lot of things are predisposed by genetic influences. Obviously, a lot of things in psychology are sociocultural, biological, just every kind of aspect. But I feel like people give too much credit to sociocultural influences for people's personalities rather than biological influences. Growing up, I always thought that my grandmother and I were very, very similar. We had almost the exact same personality. She was just a little bit more outgoing than I was. And my sister and I are, based on the Myers-Briggs personality test, the exact same. Sometimes she shifts from an INFP to an INFJ. So it makes me wonder if there's more of a biological presence, because even though my sister and I are blood related. There's a 7-year gap. She went through 4 or 5 moves in her life, while I have never gone through a move in my life. And if my grandma and I are the same personality type, she was born in 38, I was born in 97, so there's obviously some kind of larger genetic influence than we give credit for. So that brings the question of, why aren't we studying more about genetic predispositions, trying to find genetic markers that can possibly influence what personality we have. With a lot of other genetics, there are already tests with CRISPR babies of trying to find the genetic mutations and try to alter that. So we're trying to find where the cancer genes are and try to reverse that, or test for the cancer genes, and then being more wary about ourselves and being more healthy, knowing that we are predisposed to have cancer. With CRISPR babies, they genetically altered themselves. Well, not themselves. The doctors genetically altered the CRISPR babies so that they would be tolerant to HIV and HPV. So, if that's the case, with the whole designer baby thing going up in the air and everybody's talking about if that's ethical or not, there's always that question of, well, if personality is genetically predispositioned or is very widely genetically predispositioned, does that mean that we can literally have a Build-A-Bear but for our children, and making it so that our kids can have this peak personality that we want them to have to be successful? That's something that needs to be studied more, and I would be very interested in reading that, because the fact that you can just go in and pick, I want my kid to have green eyes, I want my kid to be a very outgoing person, that's just insane. And it's something that really we need to look forward to in the future, but also be very wary of. But type D personality, it's insane how much even just having type D personality can affect someone, whether it's mentally or physically.